I'm Dr. Kelsey, and I'm here today to talk about my patient Gertrude's condition. Gertrude has osteoarthritis of the knee. So osteoarthritis is considered a degenerative arthritis, which is a breakdown of the joint's cartilage. There are a variety of causes, which can be hereditary, developmental, metabolic, and mechanical, that may all initiate processes that lead to the loss of the cartilage. The main symptom is pain, causing a loss of ability and often stiffness. Pain is generally described as a sharp ache or a burning sensation in the associated muscles and tendons. Osteoarthritis can cause a crackling noise, which is called crepitus, when the affected joint is moved. And patients may also experience muscle spasm and contractions in the tendons. There may also be muscle weakness present, which in this case would mainly be in the quadriceps muscles. Occasionally, the joints may also be filled with swelling. Other symptoms may include joint pain, tenderness, stiffness, and locking. Treatment generally involves a combination of exercise, muscle strengthening, lifestyle modification, joint protection, the use of heat and cold to reduce pain, and analgesics. If pain does become debilitating, joint replacement surgery may be used to improve the quality of life. However, we would want to try and prevent that. There is sufficient evidence to indicate that physical interventions can reduce pain and improve function, which is why I have referred Gertrude to a physiotherapist.
Hi, Gertie.
Oh, hi, Katie. How are you doing today?
I'm good. How are you?
Oh, you know, so-and-so.
How's your knee feeling since I've seen you last?
Oh, well, it's still a little painful and stiff.
So based on our initial assessment that we did earlier this week, we identified some of your goals, and the main one being to decrease the pain.
Oh, yes.
And some other ones to increase strength of that knee and to also get it moving the way it did.
For sure.
Gertie, we're going to have you ballroom dancing in no time.
Oh, I can't wait.
Gertie, today we're going to use two modalities to help us achieve those goals. So our first one is heat therapy. So in here we have a heat pack that you can find at your local Shoppers or Walmart, and we just heat it up using the microwave. So it's a real simple but really effective one that will help decrease your pain and help healing.
Oh, that sounds wonderful.
So it does it a couple ways. The heat pack will increase blood flow into that area of your knee, and which will bring chondroblasts in. So chondroblasts are like little workers in your knee that will help repair some of that cartilage that you've lost over the years.
Oh, lovely.
Yeah, so it works really nicely. So with the use of the heat, we're hoping that will slow down the progression of your osteoarthritis.
Let's go ahead and do it.
Okay, so heat also decreases muscle spasm around your knee. So those muscles that surround your knee there, they can become really tight, which can also cause pain and restrict some of the movement. So we want to get you feeling like you did before. Does this make sense, Gertie?
Absolutely, Katie.
Great. So we'll be putting a hot pack on your affected knee with the folded towels underneath. You might not feel any warmth to begin with, but you should feel eventually a comfortable warmth. If it gets too hot or painful, you have to let me know immediately,
Oh,
okay?
I will.
Good, I know you will, Gertie. So do you understand why we're using the heat therapy today?
To make me feel better.
Great, and do you have any questions about it?
I trust you, Katie. I know you heal me.
All right, and am I okay to proceed then?
Yes, let's do it.
Great, so before we begin with the heat, I just want to make sure you don't have any of the following, because if you do, it could be dangerous if we apply the heat, okay? So I'll just ask you a couple questions. Do you have any blood clots that you know of in your legs?
No, my legs are okay for now, just the knee.
Good. And how about any medical problems other than the osteoarthritis?
Just the regular aches and pains, dear.
All right, and any diagnosed tumors that I should be aware of?
Oh, thank heavens, no.
No, great. And any weight loss or gain lately? Significant amount?
No, I'm okay.
Great, Gertie. Well, before we begin with the heat, I'm just going to do a sensation test to make sure that you do feel you have proper sensation in your knee.
Sure.
So I have 2 test tubes here. We have a hot one and a cold one. You can tell by looking at them. So this is, I'm just going to put it on your arm if that's okay with you, just to show you what it feels like. So that was the warm one, and that's the cold one.
Okay.
Can you, so you have an idea, and we're going to apply them to your knee, and you tell me which one you feel, okay?
All right.
So I'm just going to have you look the other way while I put them around. So how does that feel, Gertie?
Hot.
Hot, and how does that one feel?
Ooh, that one is cold.
You're right. And again,
Cold.
and
Ooh, hot.
yeah. Great, Gertie. Well, I think we're okay to use the heat pack now. I'll just have you sit on the bed, have your back against this and your legs out.
Okay.
And just scoot around. We'll put this right under your knee there for comfort.
Perfect. Thank you, dear.
And here's a pillow for behind your head.
Oh, that feels so much better already.
Oh, good. Well, here's our heat pack. I'm just going to apply it right on your knee here.
Sure.
How does that feel?
Oh, it's a little not feeling the warmth just yet.
Okay.
But you said that's okay.
That is normal. So within a few minutes, you should be feeling comfortably warm. And again, if this gets too hot or uncomfortable, please let me know as soon as possible. So I'll leave that on here for about 20 minutes. And I'll stay close. And if you have any questions or concerns, just please let me know as soon as possible.
Sure. Thank you, dear.
All right, Gertie. Well, that's been 20 minutes. How's your knee feeling?
Oh, much better, Katie. So much better.
Great. Well, we'll take this off, and we'll definitely use some heat therapy in our future treatments together.
Great.
Great. So
I love it.
perfect. So for our next treatment modality, we're going to use what we call TENS. So TENS stands for transcutaneous electrical nerve stimulation.
Oh, wow.
It's a mouthful, isn't it? So basically, I'll use an electrical current that's applied through this little machine here.
Ooh.
That will stimulate your nerves to block out the pain on your knee.
That sounds dandy.
Sit down here. All right, so you'll feel a strong tingly sensation, but it shouldn't be painful. It will increase the, we can change the controls to your comfort level. So if ever it feels painful or too strong, we can definitely turn it down.
That sounds good.
All right, and your body will get used to it throughout the 20 minutes that we'll leave it on for. So we will change it so your body doesn't accommodate. We'll modulate our machine here, okay?
Okay.
Great. So do you have any allergies to adhesives, Gertie?
Not that I know of, but we'll find out.
Oh, okay. Well, hopefully not. If you haven't in the past, these shouldn't aggravate anything.
I don't think I do, dear.
Okay, great. All right, so I'll just go through some questions like we did with the heat pack to ensure we have the green light to go ahead with our TENS.
Sure.
All right, so you said earlier no known blood clots in your legs and no malignant tumors that you're aware of. And how about any history of cardiac disease?
I had an uncle once, but nothing that I've never had any.
Nothing with you? Great. And do you have a pacemaker or any irregular heartbeats?
No, I'm okay there.
You're good?
Just the knee.
You're in pretty good health, Gertie.
Oh, I think so.
And lastly, have you ever used ionophoresis?
No, I haven't.
No. Okay. Well, do you understand the use of TENS, Gertie?
I believe I do.
Do you have any questions?
Will it hurt? You said no.
It won't hurt. If
In
it feels
that case-
uncomfortable, we can turn down the controls or we can take it off completely if you don't like it.
In that case, I'm okay with it, dear.
Great. Am I okay to proceed then?
Yes.
Fantastic. So similar to the heat therapy again, I'm going to do another sensation test. So this time I have this sterile pen here, and I'll just show you, we're going to do dull and sharp sensations.
Okay.
So this is what the sharp feels like,
Oh, that's nice.
and the dull. Okay?
All right.
So I'm going to do that on your knee, just to make sure that we're okay to use the TENS again. I'll just have you look the other way. How does that feel, Gertie?
Well, that one is sharp. Dull. Dull. Sharp. Dull.
Great. We're in the clear then, Gertie. I'll just put these adhesive pads on around your knee.
Okay.
Just like so.
Sticky.
They are sticky. Might feel a little cool too.
A little bit.
And we'll hook up the machinery. Alright, so I'll get you set up at a pulse duration of 50 microseconds at a frequency of about 100 hertz. And we'll keep it on for about 20 minutes, okay?
Okay. That's okay, dear.
Okay.
It happens.
Alright, so now we're going to turn it on here, and you just tell me when it's strong but comfortable tingling sensation, okay? Got it on.
Not feeling. Oh, there it is.
There it is. Alright, tell me when it's strong but comfortable.
Oh, I think we're there. That's
We're there?
good.
Okay. So I'm going to monitor you just like I did with the heat. And again, after a couple minutes, we'll recheck in to make sure your body hasn't gotten used to it. And if it has, we'll just modulate it to make sure that you're still going to get the same effects over the 20 minutes, okay?
Okay.
So I'll just put this right beside you here.
Okay, thanks, Katie.
And I'll be close by. Just holler if you need me.
I will.
Okay. Well, Gertie, it's been 20 minutes. How did that feel?
You know, it felt really nice.
Good. And how is your knee feeling better?
Oh, it is. We should keep going.
We should keep going. Well, that's enough for today, but definitely in your next treatment in a couple days, we'll do this in addition to the heat.
Okay.
So I'll have it off here, and I'll just get you ready to go for the day. Great. Well, Gertie, you're all set.
Thank
We'll just
you.
remove this pillow and get this out of the way here. I'll grab your cane over here.
Oh, that would be wonderful here.
Put this on the side. You're okay to get up here?
All right, thank you so much.
You're welcome.
Katie.
Well, it was great to see you again.
You
I can't
too.
wait until we see you back in a couple days. We'll have you back on that ballroom floor in no time.
Hey, now walk it out. 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 DJ Munson on the track.